It's live now.
Hello everyone, good evening. Myself Dr. Jamuna, heading Clinical Excellence and Research Team at Cure Health. I welcome you all for a thought-provoking webinar on Healthy Liver, Healthy Ever. Our guest speakers for today are Dr. Raghuram Kondala, Dr. Kranti Kumar, and our dietitian Sutapa H. Firstly, for those who do not know about our company, Cure Health, I would like to give a brief introduction. At Cure Health, our vision is to save lives super proactively. We have developed CureBook app with more than 1,500 care plans and diet plans under 30 different specialties. These plans help to monitor your vitals, symptoms, and everyday lifestyle management activities, which are specific to your health condition. We have Sheila feature in app who acts as an AI-based healthcare assistant, and she'll be able to record your vitals, symptoms, and also she'll be able to check your activities and answer to your questions related to your health condition. Under our Care Concierge program, we have highly trained nurses who will be monitoring your health condition via calls. They will do follow-up calls to take care of your health by checking your vitals, symptoms, recording whether you have done your activities, whether you're following the diet that is being listed out in your diet plans. So before we start today's webinar, I would like to introduce you all to our guest speakers. Firstly, Dr. Raghuram Kondala is a consultant gastroenterologist at Continental Hospitals, Hyderabad. Previously, Doctor has worked at Care Hospital, Yashoda Hospital, and also did his super specialization in gastroenterology at GB Pant Hospital, Hyderabad. Dr. Raghuram has done more than 25,000 diagnostic endoscopy and colonoscopy procedures till date. He has performed more than 1,500 ERCP procedures, including stone extraction, plastic biliary stent placement, PD stent placement, and more to add to it. He has good number of publications and also various poster presentations to his credit. Doctor also practices at his own Raghu Gastro and Liver Clinic in Hyderabad. Thanks, Dr. Raghuram, for joining us today.
Thank you, Dr. Jamna, for the kind introduction. Yeah.
We have Dr. Kranti Kumar with us. He is a consultant gastroenterologist at Mallareddy Narayana Multi-Speciality Hospital, Hyderabad. He has his expertise in endoscopy, colonoscopy, ERCP, endosonography, and wide range of therapeutic endoscopy procedures. He is expert in treating all liver-related and luminal gastrointestinal disorders. He is also a recipient of Torrent Young Scholar Award and has good publications to his credit. He also practices at his own Switcha Gastro and Liver Clinic, which is in Hyderabad. Thanks, Dr. Kranti Kumar, for joining us today on the session.
Okay, thank you. Thank you.
We have a dietitian, Sutapa. She works with us and she has been designing various diet plans, more than 400 under 30 different health specialties. She works very closely with Clinical Excellence team at Cure Health. She has a decade of experience in clinical diet and nutrition aspect. Previously, she has been associated with several other healthcare organizations like Fit Plus, Suita, Lean Spoon, True Weight Wellness, and Woodlands Multi-Speciality Hospital. She has done her master's in food and nutrition from University of Calcutta. As a dietitian, Sutapa thinks that diet can do miracles and it decides the quality of life. Today, she's going to enlighten us with important dietary facts about liver care. I would also like to inform all our viewers that you can type your questions in the comment section and these questions will be asked at the end of the webinar. So let's start our session for today. Dear viewers, World Health Organization says that the best thing that you can do to your liver is to treat it well. Liver is also called as second heart to the body with various extraordinary capabilities. It is in a way the most vital organ that can help us be disease-free. It has multiple roles to play, starting from digestion to saving us from many major illnesses. In recent days, we see that liver diseases and liver complications are increasing at an alarming rate. Some of the major liver complications include hepatitis, fatty liver, cirrhosis, then end-stage liver disease, and also liver cancer. Today, this webinar aims to provide a comprehensive understanding about liver complications and how liver can get affected due to our lifestyle practices. So let's start our discussion with one of the major complications, hepatitis and jaundice. So to begin with, Dr. Raghuram, World Health Organization estimates that 296 million people were living with chronic hepatitis B infection in the year 2019, which has resulted in more than 8 lakh deaths, mostly because of either liver cirrhosis or because of liver cancer. So Dr. Raghuram, please let our audience know what are the major causes of hepatitis?
Now, hepatitis is a Latin term which means that itis is inflammation, and hepatos means liver. So inflammation or a swelling of liver, which we can say in common terminology. And there are various causes. Now, the common issues would include viral infections like hepatitis A, B, C, and E. And of late, we are hearing the fatty liver or metabolic liver disease and related inflammation. So these would be the very common reasons. And alcohol, as we all understand, is another reason why the liver gets inflamed, and that is also one of the common causes for hepatitis. Yeah.
Okay. So, doctor, what would you suggest as a precaution, and what kind of treatment is suggested for hepatitis?
Yeah. So once we have identified the cause of the hepatitis, say if it is viral hepatitis, the involvement is twofold. So hepatitis A, E, and B. These can lead to acute hepatitis, meaning that the inflammation or the liver swelling tends to come down on its own. And chronic hepatitis would be caused by hepatitis B and E. So when we are talking about preventive aspects, we need to understand the routes of transmission of these viruses. Hepatitis A and E, predominantly causing acute hepatitis, they are acquired through contaminated food and water. And hepatitis B and C are acquired through blood and blood products, meaning, say, a person has undergone a surgery or he has received an injection, and these days we are dealing with disposable syringes. So the concept of reusing the syringes doesn't arise. But earlier times, there were phases when we were reusing syringes, and also blood transfusions. If they have not been properly treated or checked for these viruses, they also can lead to these kind of infection. So preventive strategy, we have vaccines for hepatitis A and B. Once the viral etiology is ruled out, the other causes like fatty liver. Fatty liver tends to be associated with weight being on the higher side. So if your BMI is more than 25, we need to be cautious. Try to bring down our weight through proper dietary interventions and regular exercise. So that would be the thing. And alcoholic hepatitis, as the name implies, the preventive aspect would mean avoiding alcohol as much as possible.
So, doctor, whoever gets infected with hepatitis, will they be also getting jaundice? Or how different is hepatitis and jaundice?
Yeah. So jaundice is a clinical manifestation of the liver involvement. So it's not necessary that each and every person who has a liver involvement or hepatitis should develop jaundice. So jaundice is seen commonly with acute hepatitis when the involvement tends to be very severe, and the damage tends to shoot up over a short span of time. And in such situations, people tend to develop jaundice. And otherwise, when we are talking about chronic hepatitis, where there is slow and sustained damage of the liver over a period of months to years, in such situations, we usually don't encounter jaundice.
Okay. Okay, doctor, thank you. So we have some questions to Dr. Kranti Kumar also. So doctor, in which type of hepatitis death rate is usually high? And why do you think that this type is really important and a serious condition?
Like coming to these both infectious hepatitis like hepatitis B and hepatitis C, out of these two, hepatitis C will be having more mortality rate than compared to hepatitis B. The death rate of hepatitis C in 2007, it is 4.6 per 1 lakh population. Now, because of various modalities of treatment, it came down to 4 per 1 lakh population in 2019. Coming to hepatitis B, the death rate is 0.4 per 1 lakh population in 2017. Now it came down to 0.37 per 1 lakh population. So these are because of various new modalities of treatments like antiviral medications for hepatitis B and hepatitis C. And other forms of hepatitis, especially from alcoholic hepatitis and those related to other metabolic causes, the death rate depends upon the severity of liver disorder.
Okay, doctor. So, like Dr. Raghuram had mentioned that getting vaccinated is one of the preventive measures. So, my question to you is, doctor, like, can hepatitis infection because of this vaccination can be completely prevented, or is there any age group that has to get vaccinated, and how often do we need these vaccinations for hepatitis?
So out of all viral hepatitis, hepatitis B had got good efficacy. That vaccine got good efficacy. It will give protection with the three doses of vaccination. The person will get at least 97% of protection from hepatitis B. So vaccination schedule usually approved by WHO is 0-1-6. The person should take doses at 0 followed by 1 month and 6 months. And that dosage schedule and those these things will be vary depending upon the age and the weight of the patient. Now they have included that in the universal immunization program. Those who has not taken during this childhood, they can take in their latter age group. And those especially more prone to get infected, like medical personnel and who are in high risk group, they can take vaccination whenever needed. And depending upon their antibody titers, usually they'll measure their vaccination efficacy. Accordingly, they can take booster dose if required. So that vaccination efficacy and that requirement of booster dose will assess by doing antiviral like anti-hepatitis B antibody titers. If they are more than 100, there is no need to take booster dose. If it is between 10 to 100 international units, they need to take a single booster. If it is less than 10 international units, they need to completely take a complete vaccination schedule of three doses of 0, 1, and 6.
Okay, doctor. And also, doctor, now jaundice has become most common condition, which is requiring a lot of medical attention, especially among the newborn infants. We got to know that through reports, about 50% of term and 80% of preterm infants, they develop jaundice, usually in the first week of life. So, doctor, please let us know, why is this jaundice very common only in newborns, and how can we prevent this?
So coming to newborns, the cause of jaundice are physiological as well as pathological. So majority of these jaundice in the newborn can be physiological, so which can be managed easily with few measures like phototherapy and exchange transfusions. Whereas pathological jaundices, especially because of few syndromes like Crigler-Najjar syndrome and few hemolytic conditions, they need special attention because it will lead to a condition called kernicterus, that is the passage of ammonical compounds into the brain, leading to altered sensorium and seizures. So they need special attention. Whereas physiological jaundice can be managed with like routine measures like phototherapy as well as exchange transfusion. Coming to the causes, why these infant groups develop jaundice, majorly they'll be having these jaundice because of damage to the RBC, leading into the release of heme byproducts, that is bilirubin and bilirubinin, leading to jaundice. Whereas few syndromic associations, especially Crigler-Najjar syndrome, that is a congenital one, so that needs special attention.
Okay. Okay, doctor. Thank you.
Yeah.
So let's move to some diet-related aspects. We have our dietitian Sutapa. Please let the audience know about diet which is recommended for hepatitis, what to eat and which foods to avoid.
Hi, everybody. So that's a great platform that where we can discuss about the diet aspect, because I think diet aspect is as important as the medical interventions. So let's talk about when we talk about hepatitis. So I would say diet will play a precautionary role. I cannot say a diet can completely cure hepatitis, but yes, if the liver is infected, then a proper liver-friendly diet we have to follow. So what we call about liver-friendly. So if there is any kind of infection in any part of our body, we know right now everybody may be aware that we must eat or we must include anti-inflammatory or high antioxidants rich food. So as we know, liver is the basic organ which helps us to digest the fat. So we need to reduce the fat content. So fat content overall reduction means it will give the liver rest to recover, because we cannot pressurize the organ with the same food, which is the main task of that particular organ. So what do we know about this? If you tell me about what to eat, then we just need to focus on the high fiber food. High fiber is a magical nutritional aspect, I can say, that where they engulf the excess fat and gives the body a lesser fat percentage. The fluid intake, if there is no restrictions from the medical intervention, because at times with hepatitis, we see a lot of swelling. So if there is a swelling or edema experience, we must take care about the fluid intake also.
Okay, and also it is advised post jaundice that we must keep an eye on our food. So
yes.
How much recovery time it takes after jaundice to initiate a normal diet?
So first we need to know what is a normal diet. Then, so a normal diet is not like, including a junk or eating out. Of course, that will be a part of your life, but we need to know where to stop, especially when your liver is once affected, because jaundice or recurrence, it can occur recurrent. It can come again and again if the medical intervention or the diet is not followed properly. So for jaundice, we see a total heal up or total efficacy will come almost 6 months. But we need to be very conscious about our fat content. A normal diet means all the fat food groups will be divided in a proper dietary allowances. As per the ICMR guidelines, we have all the measurements. We have, as per the doctor said, that we have to take care about the overweight issues, because once you are overweight, that is the root cause of every liver problem.
Okay. Okay. Thank you, Sutapa. So let us now move to the next complication of liver, which is fatty liver disease. We know that fatty liver disease has become more common among younger as well as adult population. Alcoholic fatty liver disease, which is caused due to over alcohol consumption, is seen to be less prevalent when compared to non-alcoholic fatty liver disease. And report states that non-alcoholic fatty liver disease affects about 25% of the global adult population. And the prevalence in India is about 32%. So Dr. Raghuram, please throw some light on what is non-alcoholic fatty liver disease and who are the ones which are most affected.
So when we're talking about fatty liver, we need to divide that into two broad categories. One is the fatty liver which tends to develop secondary to regular alcohol consumption. So we'll be eliminating that thing. Once we have eliminated that thing, the broader group or the commoner group of non-alcoholic fatty liver disease tends to remain. So when we're talking about the non-alcoholic fatty liver disease, or this term has been introduced, metabolic fatty liver disease in the recent times. This tends to happen because of two common reasons. One, weight being on the higher side, combined with lack of exercise or a sedentary lifestyle. Number two, people who have diabetes. So once you have diabetes, the problems, the underlying root causes which lead to development of diabetes, they are playing a role in the development of fatty liver as well, right? So these would be the two common reasons. I mean, almost 95% of the times we are dealing with one of these reasons when we are talking about non-alcoholic fatty liver disease.
Yes, doctor. As you rightly said, that non-alcoholic fatty liver disease is directly linked to increase in type 2 diabetes and also cholesterol. So also please explain us why usually this happens, and how is that we can prevent, especially in case of diabetes or people with high cholesterol.
Now we tend to see that most people who have fatty liver, they tend to have diabetes, and also people who have diabetes, in them around 80 to 90% also have the fatty liver. Now, there is no direct study which has found a causation kind of thing between these two entities. But as a general thing, we understand that the fatty liver tends to be associated with abdominal adiposity and visceral fat deposition and fat deposition in general, right? So when we are talking about this adiposity, as a sequence to that, people tend to develop insulin resistance. So the normal insulin which is being produced by the pancreas, the normal levels of the insulin hormone is not sufficient to maintain the required functions. This thing is called as insulin resistance. Slowly over a period of time, when the insulin resistance tends to worsen, then you tend to develop diabetes. So that is the basic correlation between fatty liver and diabetes. And again, when we are talking about insulin resistance, insulin is an anabolic hormone. And so when the insulin is not able to act properly on the end organs like muscle or liver, the cholesterol levels also tend to shoot up, right? So this is the basic mechanism by which the fatty liver, cholesterol, and diabetes tend to be associated.
Okay, doctor. So already you mentioned that being obese and overweight is one of the causes for non-alcoholic fatty liver. So does this mean that all people who are in obese category or overweight category will get this fatty liver condition?
Not necessarily, but yeah, the percentage of NAFLD or the metabolic fatty liver disease tends to be anywhere between 60 to 90% when the weight is on the higher side. And again, as the BMI tends to increase and you fall into the extremely obese category or the very high BMI category, then the percentage of people who have fatty liver also tends to be on the higher side, to the tune of 90%. But say if your weight is just above the required limit, say between 25 to 30, in them, what has been seen is around 60%, they tend to have this fatty liver.
Okay. Thank you, doctor. So, Dr. Kranti Kumar, I have a very interesting question for you. In a recent clinical study in Southern California, it has been revealed that more than 30% of women who are suffering from PCOS, they develop non-alcoholic fatty liver disease. And this is being linked to obesity and also for increased insulin resistance and high androgen levels. So, doctor, does this mean that all women with PCOD or PCOS condition, they are more susceptible to get fatty liver disease?
No, not exactly. But a majority of people with PCOS tend to have this thing, fatty liver in their phenotype, because the pathogenesis of both these PCOS as well as fatty liver is more or less same, but not exactly that all women with PCOS tend to develop fatty liver.
Okay. Okay.
Yeah.
And also, doctor, it is reported that patients who have some type of prescription medicines or even steroids, they develop this non-alcoholic fatty liver disease. So how will patients know that whether they have to take decision on what medicines they have to avoid or what they have to take in order to prevent this fatty liver condition?
So on their own, they can't make a decision which like prescription need to be followed, which they should avoid. They should take suggestion of the treating physician. But coming to the drugs, which usually tend to cause fatty liver or liver damage, in like antibiotics, a few antibiotics like combination of amoxicillin and clavulanic acid, if they take for a quite long period, they tend to develop liver damage. And few immunosuppressants, especially methotrexate, if they take it for a longer duration, they'll tend to have liver fibrosis. And coming to the fatty liver, as you told, few steroids and other medications which are prone to have this thing affect this thing, insulin resistance definitely will have fatty liver as a side effect. So the decision which drug need to be halt and which need to be continued will purely depend upon physician discretion.
Okay. And in some cases, doctor, like after surgery, the steroids become mandatory. Though we know that it causes effect on health condition, but it is advised to be taken. So in such cases, what does a patient do?
So it purely depends upon the duration, how long you are taking those drugs. If definitely that steroids, whichever the medications are needed, they can take, but it depends upon the dosage as well as duration. If it is within the normal limits and permissible limits, it won't cause any damage to the liver. But those who are already affected with the liver disease, they need to be cautious about the dosage and that medication duration. That is purely decision of the physician, treating physician as a surgeon. They'll decide whether it is safe to give that medication in that particular person or not.
Okay, thank you, doctor. So coming to diet part, so our dietitian Sutapa, she has already designed various diets for fatty liver condition. So Sutapa, please let our viewers know about diet restrictions for this fatty liver condition. And also, do you suggest different diets for alcoholic and non-alcoholic fatty liver condition?
Yes, coming to the difference part, so there is a much more salt restriction for alcoholic fatty liver disease because as per a lot of studies, we have seen that their patients, they experience edema, as I said in my previous answers, that they experience, and the number is quite high, means when we take a graphical number, then we see that the number is quite high. So there is a salt restriction because much more salt or it will enhance your pressure. That is a different part. Another one, it will hold up the intercellular water. So that will increase the edema consequences. And coming to non-alcoholic fatty liver disease, the main part is to infuse MCT. So what is MCT? Is middle chain triglyceride. So those are actually very helpful. As doctor said that during fatty liver, insulin resistance is one of the barrier that we cannot, the diet aspects, medical interventions are very much required. So insulin resistance, MCT, they help to reduce the resistance of insulin, and they help to subsidize a proper balance of good fats which is needed, because fat has a very interestingly, there is good and bad fat. So we cannot just say we have to remove the completely fat because we have fatty liver, but we need to encourage the high healthy fats, which is MCT, mu5 means monounsaturated fatty acid, like that. So ghee and coconut oil, those are always good for fatty liver. It's absolutely a myth that we should not be having ghee, but obviously there should be a limited amount. Every if the person is having diabetes with associated fatty liver, the amount will be 1 teaspoon. And I would like to just entitle some few items which we usually eat, like we have to increase the green tea, green coffee, because a normal coffee, they are highly toxin. So when liver is already in a distressed position, let's not enhance the toxins, biotoxins. Then we have to encourage the green leafy, because green leafy vegetables will reduce the fat accumulations throughout the liver, and it will help to help bile to be so perfectly secretion, so that the whatever limited fat intake you're having, the digestion and absorption should be flawless.
So usually almost all food items contain fats in various amounts. So how do you remove fat from the diet of a liver disease patient? Is it really possible to eliminate fat completely?
Absolutely not possible.
Yeah.
So you cannot eliminate fat, and you should not eliminate, we should not eliminate fat, because if we eliminate fat, if we think, see, if I eat every day only salad, definitely my diet will be negligible amount of fat, very negligible, because sorry, as per our height and body, we have, as I said, we have the requirement of all the nutrients. So if we constructively reduce it, the biological processes will be hampered. But what if we have a problem when we have fatty liver condition? Am I audible?
Yes, you're audible. Okay. And we also know
sorry,
that fats...
network is... Yes. So
yeah. Sutapa, you can hear us, right?
Yeah. Yes.
Yeah, okay. And like you rightly said, that fats play a major role to maintain the optimal health. But usually during some liver ailments, this fat is restricted, right? Then how do you suggest an alternative way to maintain the positive aspects of fats during these liver disease conditions?
Yes, I would like to enlighten my audiences about not to take care about what we are taking. We have to take care about the cooking process also.
Okay.
Every liver ailments are related with vitamin A deficiency, or mostly it is vitamin A deficiency. Vitamin K also helps to regenerate the liver cells if it is infected. So how do we understand the right cooking processes? So I would say all the people who are listening to us that adding extra oil will not make your food tasty. So palatability is something that we need, obviously, because if the food is not palatable, we will not eat, and we will dump into the something wrong eating pattern, which will hamper the liver. And liver, as it's a factory of the body, we have to be very cautious about that liver health. So now, as per your questions, that what is the alternative? So alternative will be to not using multiple used oil. Like suppose you have used a oil, some fries or something, let's not multiple time using, because if you use or heat up the same oil, the fatty acids chain will break down. And in olive oil, it will change the chemical configuration, and it will become a saturated fat, which is very, very harmful for the liver. Now, coming to the daily thing, let's not choose the, the margarine, then multiple used oils. So we have to shift in something a little healthy, like ghee. As I said, ghee is always healthy for the body. Coconut oil, you can fry. I mean, if you want to fry something, go for shallow fry. Make it boil first, then you do a shallow frying with coconut oil. Okay, so some exchange of the fats will definitely help you, because removing the fat completely is practically not possible.
Okay, thank you, Sutapa. So let's start discussing on the major complication of the liver, which we usually call liver cirrhosis, and which leads to end-stage liver disease. And also we'll discuss on liver transplantation. So this liver cirrhosis is a very a major cause for mortality and morbidity across the world. it is said that it is the 11th leading cause of death and 15th leading cause of morbidity worldwide. So Dr. Raghuram, please let us know what are the major causes of this liver cirrhosis condition and which are the different stages of liver cirrhosis that our audience should know about.
Yeah, so when we talk about major causes, it will be a kind of repetition. Only thing is we need to exclude the viruses which lead to acute hepatitis. The hepatitis A and E viruses, they tend to cause acute hepatitis, and they usually don't cause liver cirrhosis. But hepatitis B and C, since they cause chronic hepatitis, there is a slow and sustained damage of the liver over a period of years, and that can lead to liver cirrhosis. Looking at the pattern of treatment that we have available for viruses now, I assume that in the coming decade or two, this non-alcoholic fatty liver disease will become the major cause of cirrhosis. Now, that is the second thing. And third, like we all know, alcohol is one of the reasons why the liver cirrhosis tends to develop. And when we are talking about the stages of cirrhosis, there are two stages. One is a compensated cirrhosis, where the liver is in a balanced situation, although it has been affected and there is a lot of fibrosis or scarring which has developed in the liver. It is still in a working condition. So this is called as a compensated cirrhosis. And the other thing would be the next stage would be decompensated cirrhosis, where there is fluid accumulation all over the body, predominantly in the abdomen, in the feet. People tend to develop, side effects of liver cell failure, like going into drowsiness or coma, what we call as encephalopathy, or at times the kidneys can also get affected. We call this as a hepatorenal syndrome, meaning that the kidneys are involved secondary to the liver cirrhosis. So various issues can arise in this decompensated cirrhosis stage.
Okay, so also, doctor, some of the reports say that around 35% of these patients develop alcoholic hepatitis, and around 10 to 20% they develop liver cirrhosis. So apart from alcohol consumption, what do you think, doctor, this liver cirrhosis is caused by?
Yeah, we've already talked about it just now. So predominantly hepatitis B and C. But the thing with hepatitis C is we have a good variety of medications, and the armamentarium is ever expanding when we're talking about hepatitis C. So good antivirals have made the virus a subdued one. We are achieving good cure rates with the currently available antivirals when we're talking about hepatitis C. Hepatitis B, although a cure is not possible in the present scenario, we don't have medications of that kind, but the virus replication can definitely be controlled. And once we identify hepatitis B and we initiate antivirals if required, the disease tends to come to a halt and the progression can be avoided. So alcohol related cirrhosis, again, the problem is by the time the patient develops symptoms, it's already in a decompensated state. And so it's already in a pretty advanced form, and stopping alcohol alone may not be sufficient for the recovery to happen. The same holds good for non-alcoholic fatty liver disease, in the sense that if we identify that in a compensated state, we can go for corrective measures. Otherwise, if it is identified in an advanced stage, then probably we may have to think about liver transplant.
Yeah. Yes, doctor. So let us discuss about liver transplantation in detail with Dr. Kranti Kumar. So recently, the field of liver transplantation has undergone remarkable advances in almost last 2 decades. A liver transplant is now the treatment of choice for patients with acute and as well as chronic liver failure. So Dr. Kranti Kumar, please elaborate on the indications of liver transplantation and how long can a patient live with a liver transplant?
So coming to the indications of liver transplantation, before going into that, what are the types of liver transplantation? There are usually, broadly, there are two types. One is live donor liver transplantation, where liver is taken from a living donor, living healthy donor. Part of his liver is taken, taking the privilege from good regenerative capacity of the liver. And second is a cadaveric transplantation. Here, that liver is taken from the dead person with his consent. So coming to the indications of liver transplantation, usually all chronic liver disease patients, those who are cirrhotics, may it be compensated or decompensated cirrhotic, those are candidates of liver transplantation if there is no absolute contraindication. Second is coming to the acute conditions like alcoholic hepatitis, acute liver failure because of any virus or any drug-induced liver injury. Few metabolic conditions like Wilson's disease, and in female, entity called autoimmune hepatitis. Those patients with the acute liver failure, those are the candidates for liver transplantation. And the second is, as I told you, types of liver transplantations are two. And the quality of life that patient is going to have after transplantation is quite good, especially in the younger patients. They'll be having good quality of life, but they need to take proper care about that recipient liver with a few immunosuppressant drugs like steroids and this thing, tacrolimus and cyclosporin. That will be taken care by a transplant physician.
Okay.
Yeah.
And also, Dr. reports state that in 2021, around 9,000 individuals, they have received this liver transplant. And still around 11,000 people are waiting for transplant. Like you already mentioned, extensive research has been done, and it's proven that liver has a unique capacity among other organs which can regenerate itself, even from a small piece after any kind of damage or even after removing 90% of it. So for liver donation, even small lobe should be sufficient. But doctor, why is that we still see patients who are waiting for liver donors?
There are two things here. One is lack of awareness and apprehension in the donors. These two are the main reasons, especially in case of live donors, because the cadavers, those who are giving this liver, willing to donate after their death, it is not sufficient to cater the people who are requiring the transplantation. So majorly live donors should come forward. It should be done by proper awareness, and their apprehension need to be clarified by transplant physician that nothing will happen to them if they were properly evaluated with liver volumetry, and screening programs will be there before giving the donation. So by doing that, we can significantly improve that live donors.
Okay. Okay, doctor. I have one more interesting point to discuss with you. In 2012, a remarkable case study was done where a 60-year-old man in Kerala, he had undergone liver transplant. And in 40 days, he found that most of his hair had gone black and he felt very younger. So does this mean, doctor, that if you take good care of your liver, the aging process is delayed? Or does this happen in all people who have undergone liver transplant?
No, not exactly aging process, but those who are having a healthy liver, especially their micronutrients like vitamins and minerals, those will be in sufficient amount in this body, which are needed for maintenance of proper hair and whatever you are telling, that aesthetics. Those are properly taken care by micronutrients. Those who are having a healthy liver, micronutrients in their body are properly maintained. So they will be having a very good aesthetic look in their skin, or hair. Those look healthy.
Okay, okay. Thank you, doctor. So coming to our diet aspect, So Sutapa, can liver cirrhosis patient or end-stage liver disease patient follow the same fatty liver diet? Or do you suggest any other type of diet for these patients specifically?
See the exactly what you said right now, that sorry, the cirrhosis and the end stage that liver disease patients. So this depends upon the severity and the profundity of the diseases. So I cannot just say yes, they can follow the fatty liver diet, because fatty liver diet is a normal course of diet, just a fat restricted and some vitamins pushed, more fiber, the alteration of some nutrients. But coming to this cirrhosis and end stage 1, so there mostly if the seriousness is quite high, doctor may suggest TPN. So that means a total parenteral nutrition. That's a innovative infusion process to push the food, I mean any form of liquid form of a food or a formula food through veins, intravenous.
Okay. And also we know that nowadays this concept of reversal diabetes has become very common, and this is mainly targeted via diet. So is it possible even in case of liver that we can reverse these liver diseases through diet?
To be honest, it depends upon, that's what I said, the severity, but we cannot reverse the very highly critical, like cirrhosis is very critical. Then hepatitis, as doctor said, we have vaccines also just to, to protect ourselves. So it may not the reverse thing, but diet will play definitely a strong precautionary shield for every liver diseases. So we can completely 100% take care of our liver through diet if we just take care of few steps, like very few precautionary steps. There's nothing very strong or very strict plan. It's just that we need to believe that diet is not a punishment, until and unless we believe that if we can take care of our optimum health, no matter it is liver or eye or any immunity. It's just that we just need to focus on the right balanced food. But for liver, we just need to take care what fat we are choosing.
Okay. Okay. Thank you, Sutapa. So coming to our last topic for discussion today, liver cancer. Worldwide, liver cancer is the leading cause of death. And in 2020, more than 8 lakh people around the world, they died due to liver cancer. So I have a question to Dr. Raghuram. Please let our viewers know what are the causes of this liver cancer and what kind of precautionary measures, or even how we can detect this liver cancer at an early stage.
Right. So when we're talking about the causes of liver cancer, we need to understand that any problem which causes liver cirrhosis can also cause liver cancer, because liver cancer tends to develop on the background of cirrhosis in most of the cases. The cirrhotic liver or the scarred and fibrotic liver is a kind of fertile ground where the tumors tend to develop, right? So whatever problem tends to cause liver cirrhosis, they are automatically would fall into the causative agents or causative factors leading to liver cancer. Irrespective of the liver cirrhosis, there are certain things like hepatitis B virus. So the strange thing with hepatitis B virus is it can lead to liver cancer even without causing liver cirrhosis in between. So direct development of liver tumors can happen if you have hepatitis B virus infection. And there are other rare causes like glycogen storage disorders and fungal toxin. There's a fungal toxin called as aflatoxin, which is very common when a fungus or a mold tends to develop over the food items, right? Okay. So this aflatoxin has also been incriminated as an agent as a causative role, which has a causative role in development of liver cancer, right? So these would be the common reasons for liver cancer. So how do we prevent that? If you have hepatitis B, you need to visit your treating physician on a periodic basis. Monitoring using serial ultrasound, say if there is already liver cirrhosis which has developed, then we tend to screen the person once every 6 months using the ultrasound scan, which is a recommended screening protocol. And over and above that, we have tumor markers like alpha fetoprotein, but this marker may not be elevated in all the situations. So if there are 100 patients who have liver cancer, only 60 to 70% of them will show an elevation in the alpha fetoprotein, right? So usually if a person has cirrhosis, then serial surveillance ultrasound scans every 6 months should be helpful.
Okay, okay, doctor. And it is well known that even excessive alcohol consumption contributes to liver diseases. And also, doctor, is it like people who consume more alcohol, they also have the tendency to develop liver cancer?
Not directly, but then through the development of liver cirrhosis, there is a risk of liver cancer. The problem with alcohol is it is a direct causative agent for other cancers like stomach cancer, the oropharyngeal cancer, the throat cancer, right? So even if it is not a direct causative agent for liver cancer, it can lead to liver tumors through the pathway of liver cirrhosis, and it acts as a risk factor for other cancers in other parts of the body.
Okay, okay, doctor, thank you. And Dr. Kranti Kumar, I have one more interesting question for you. A new study from Queen's University has found that people with poor oral health are more likely to develop liver cancer, which is making to 75% increase in susceptibility. I was really surprised to know, like, how is oral health related to liver cancer? Is it important to maintain oral hygiene to prevent liver diseases, Dr. Kranti Kumar?
No, it is not directly related, but majority of people who are having a poor oral hygiene, they will be having a state of dysbiosis in their intestine. That is that ratio between the useful bacteria and harmful bacteria will be altered.
Okay.
So usually our gut will be having more useful bacteria rather than the harmful bacteria. That is a state of eubiosis, we'll call it as. When it is subjected to alteration because of various modalities, like our dietary habits and our like obesity and habits like smoking and alcoholism, taking excessive antibiotics, these eubiotic state will be subjected to alteration, leading into the state called that alteration of gut will be in such a state that more number of harmful bacteria will be there. So these indirectly will cause alteration in the few enzymatic pathways as well as metabolic pathways, leading to that more that liver cancer is not directly related to that, but who are already having other predisposing factor for liver cancer like cirrhosis, hepatitis B, and this non-alcoholic fatty liver disease. That process of developing liver cancer will be hastened. So they'll tend to have that develop liver cancer much early. Yeah.
Okay. Okay, doctor. So does that mean that liver transplantation becomes mandatory for liver cancer patients?
Depending upon indication, those who are young with acute liver failure because of various things, as I told you, if they get a proper donor, better they go for the liver transplantation so that they'll be having a healthy and long life. If they take proper care of the donor liver with immunosuppressants, whereas those who are having chronic liver disease, especially decompensated liver disease, the indication of liver transplantation depends upon how properly they take care of those donated liver. That's why the guidelines for that liver transplantation, especially those who are having a history of alcohol intake, it is restricted only to those patients who at least stopped that alcohol consumption 6 months prior to the transplantation, so that it will be assured that that particular person can take proper care of that liver after transplantation by stopping alcohol consumption. So unless there is no strict contraindication, that liver transplantation is advised, but main advice is for acute liver failure and especially for young persons.
Okay.
Yeah.
Okay, doctor. Thank you. So Sutapa, let our audience know if there are any specific diets which you suggest for liver cancer.
Yes. So when it comes to liver cancer, we have to take care about the inclusion of antioxidants foods. So which are antioxidant foods? Usually yellow, red color fruits and vegetables, green, those are all rich in vitamin A, vitamin C. So these vitamins anyway has an antioxidant role. And apart from this, so why we are suggesting antioxidants, that I need to focus here, because these cancers, whenever we have any carcinoma in our body, in any organ, that means there are a lot of free radicals which is freely roaming around. So these antioxidants will engulf them and help us to remove these free radicals and help to regenerate the cells. And coming to this regeneration, obviously we need protein, because without protein, no cell regeneration is possible. So coming to protein, so red meat is also high in protein and lean chicken also high in protein. But we have to go for lean protein, which is lean chicken, like the breast piece, chicken and a breast area of the chicken, then fish. Fish is very good for liver diseases because those are high in omega fatty acids. Omega fatty acids are very, very helpful to maintain any kind of carcinoma, especially liver one, because it will help to regeneration the every carcinogenic damaged cells of the liver. And coming to our so you can enrich your diet with green leafy nuts, avocados, olive oil, and you have to change your oil. So you can go for cold pressed oil. So cold pressed oil, they have very good composition on the fatty acids. So they are mono and polyunsaturated fatty acids. Those are helpful. These are important for liver function.
Okay. Thank you. Thank you, Sutapa. So we have come to the end of our webinar session for today. So I would request Neha to ask if there are any questions from the audience side.
Thank you, Dr. Jamuna, and thanks all the doctors. And we do have few questions from our audience. One of that is, as you have seen since COVID, the self-medication thing has seen a spike. And along with that, the fear of going to doctors and hospitals has again increased self-medication. So Dr. Raghuram, the question is, do self-medication have side effects on liver? And if so, and how, people can stop that from happening?
So when we are talking about medications taken over the counter and associated liver injury, the common agents that come to my mind are painkillers. So commonly used painkillers like diclofenac, which comes in the brand name of Voveron, then Combiflam, Brufen, all these things, they tend to have a tendency to have to affect the liver, right? So that is one thing. And commonly used antibiotics like Augmentin, which contains amoxicillin and clavulanic acid. These are also notorious when we're talking about drug-induced liver injury, right? And even paracetamol, when taken in larger than the prescribed doses, they also can lead to liver injury. And it is one of the common causes of liver failure in the Western countries, right? So, yeah, any medication without a proper prescription, there has to be a level of caution which needs to be exercised when we are taking them.
Thank you, doctor. And just one last question as well as moving towards the end of our session.
Sure, yeah.
In cases of liver cirrhosis, patients are asked to control their water intake. And given the scenario, what is the exact reason why they need to regulate their water that they are taking?
So when there is a decompensated liver cirrhosis, the body is trying to retain sodium and in order to maintain the blood pressure and the fluid balance of the body. And secondary to that, once there is sodium retention, the fluid also tends to get accumulated within the body, and these people have fluid in the tummy, fluid in the feet, right? And also at times there is a thing called as hepatorenal syndrome where the kidneys get affected, secondary to liver cirrhosis. So in such situations, based on the urine output and to promote water excretion by the kidneys, we tend to recommend fluid restriction. Usually that could be around 1.5 liters in a day. Or if we want to be more exact, then we need to measure the urine output in a 24 hours duration and add around 300 to 400 ml to the 24-hour urine output to balance for the insensible water losses, right? So these are the situations when we tend to recommend a fluid restriction.
Thanks a lot, Doctor. And I think so. It was a very insightful session today that we had. And Dr. Jamuna, I think so we need to wrap it up now. So over to you.
Yeah. Thank you, Dr. Isha. So I'd like to thank Dr. Raghuram, Dr. Kranti Kumar, and our dietitian Sutapa for your valuable suggestions about liver complications. I'm sure that today's audience would have got enlightened on the importance of this organ, liver, in our body. And all will surely follow the mantra, healthy liver, healthy ever. So dear viewers, to avail the benefits of our Cure Book app and care plans and diet plans that we have in our app, please download Cure Book from Play Store. It is freely available. You just have to type QURBOOK. We will be very happy to serve you and your healthcare needs. Kindly contact us for any kind of subscriptions or queries. Thank you all very much for joining us today. Take care. Bye-bye.
Thank you.
Thank you. Bye.
Bye.